Hello, everyone. Heather Holmes here with KTVU Fox 2 News in the San Francisco Bay Area. And we are now getting an update on the coronavirus with Dr. Rashid Chotani, someone that we've been talking to now for several months about the pandemic. He is medical officer at IEM and someone who is studying the coronavirus, taking a really close look at it. Doctor, appreciate you being here once again.
Well, thank you, Heather, for having me. And obviously, this is a very critical topic, which is affecting the nation and the world adversely. So I'm glad to talk about it.
Yeah, I wish that we were talking about a more positive aspect of the coronavirus, but unfortunately, Doctor, we are seeing just about every part of America now enduring an increase in cases.
But it's not just America. You know, we've got 50 million cases worldwide, 50 million and 1.3 million deaths worldwide, which is a huge number. In the United States, based upon who you're looking at the data, we've got anywhere between 10.5 to 10.8 million cases. And, our death toll is unfortunately 240,000. Now, just keep that in mind and think about that. We had 144,000 cases yesterday, which is a 69% increase over 14 days. And our deaths yesterday were 1,893, which is a 36% increase over the last 14 days. Now, these are huge numbers. If this continues, we will be getting approximately 1 million cases per week and about 7,000 to 8,000 deaths per week. And that means that, by the end of the year, we will be, think about the number, 1.7 million cases and about 300,000 deaths. That's a huge number. On top of that, the hospitalizations that we have increased tremendously. We had 65,000 people hospitalized yesterday, which matches the April peak that we had. And now, the critical thing to understand is that we've not really peaked at this point in terms of this surge. So it is a catastrophe. It's a major problem. 44 states have increased numbers. Texas and California have over 1 million cases each, right? And that puts them, like, if we look at the globe, the world, and we look at all the different countries, that puts them at about 10 or 12 number, which is unbelievable. Each state, 1 million case. Illinois and Texas, had 12,000 cases yesterday. Ohio, Michigan, Wisconsin, Pennsylvania, and even California. And I understand why the governor is trying to do what he's trying to do in California. The numbers are just going up. The most interesting thing to understand and appreciate is that the test positivity rate has really climbed up. Remember, it had gone down to about 3%, but nationwide now, I'm not talking about the states where they have high intensity of the disease, but nationwide, it's about 9% now. That is just unbelievable. States like Texas and specifically El Paso, are at, the numbers have just gone up, and, hospitals are near breaking point over there. With the number of people being hospitalized, over 1,000 people were hospitalized yesterday. Over 300 people in intensive care unit, about 150 or 140, had to have ventilators. I mean, in all honesty, this has become a humanitarian crisis right now. And, and I hate to say this, but, we are entering what I call the dark winter. Now, if we want to keep our economy open, we can still do it. If we don't want the lockdowns, we can still do it. But we've got to double down, triple down on the basic preventive steps that we were talking about. We all talked about social distancing and masking. So all can be done, but we all have to work together for that.
Okay, but given all of that, Doctor, sobering news, we are getting ready to celebrate Thanksgiving. How do we do that in a safe way? What are you encouraging people to do?
Well, Thanksgiving is, my God, it is such an incredible, incredible holiday. Not just Thanksgiving, we are about to enter, Christmas. We are going to have New Year's, but Thanksgiving is the first one that is coming. And that's when the families get together and celebrate, a holiday which, all different ethnicities, all different religions, because they're Americans, celebrate. And, this year is not going to be the same. This year, we've got to be extra cautious and extra careful. If we want to have Thanksgiving dinner, if we're going to invite guests, make sure that you don't have somebody at your home, or you're not in that high risk group, you do not have comorbidities. Obviously, if you have any type of symptoms, you don't want to have that. Make sure you're doing it outside. If you cannot do it outside, keep the windows open. Make sure everybody's masking. Make sure that you are creating these pods that are, the tables that each family can sit separately. Make sure that you are serving food in a way that everybody's not putting their hand in the same dish. Lots of precautions needed: social distancing, masking, outside. If it's cold, what you can do is you can have an outside event, and as a gift, and this is what I'm going to do if I'm going to have one, is to have blankets, and tell my guests to take the blankets with them, with the fire pit in the middle, so that, or some kind of an arrangement that they're not that cold, and make sure that the food is served to them rather than them getting the food themselves. One person serving the food, one person serving the drinks. You have disposable items, so that you don't have to worry about washing them and all that kind of stuff. Making sure that you have hand sanitizer. If people want to use the bathroom, make sure that they know that they should not be touching all over the place, and then make sure that you're cleaning and disinfecting, and they're also disinfecting themselves. So you got to be very careful. Ideal thing is that you just have Thanksgiving with the people that you're living with, co-inhabitants, and if you really want to have something else, then it's going to be tough, but you can do it, but do it carefully.
Boy, are things going to look different when you talk about all of the precautions that one needs to take. So really, you're sort of saying it's not a good idea, folks, to get together with people who are outside of your household.
Absolutely true. And and a lot of people, some of the top infectious disease folks have said the same thing, and I'm going to say the same thing. If you can, if you want to be really, really careful and cautious, not just for yourself, but the people that are going to come visit you, right? You want to have this one by yourself. Zoom in. One of my daughters lives in a different state, and I'm not kidding, seriously. And guess what? We're going to Zoom in because we don't want her to travel. She doesn't even live too far. I live in Virginia. She lives in Maryland. And, right now the rates, the numbers are really, really skyrocketing in Maryland. So what we'll ask them, we'll ask her to do, and she actually wants to do it, is just connect on Zoom, and she'll have her Thanksgiving and we'll have our Thanksgiving, but we'll rejoice it together.
Mhm. Kind of save the celebration for next year. Let's all just get through this year. Speaking of next year, doctor, we did get some really great news about a vaccine on the horizon, and really kind of exceeding expectations here in regards to how effective it is. Let's talk about that Pfizer update regarding its clinical trials.
Yes, absolutely. Super news, excellent news, outstanding news, brilliant news. But I have to first give credit to Operation Warp Speed, because this is the first time, I believe, in the history of this world that we are getting a vaccine or a therapeutic, and we'll talk a little bit about another therapeutic that has gotten FDA approval. Never in the history of the world during a pandemic has a countermeasure been developed. So the folks that pushed Operation Warp Speed, the folks that have been working on Operation Warp Speed, they have to get credit for doing a tremendous job, and they have done it. Now the Pfizer vaccine is going to be 90% effective. And how do we know that it's going to, where did the data come from? So there's an independent committee, okay, and it's on a set date, which is set up a priori a long time ago. They unblind the data and take a look at it and do that observation. While doing that observation, they realized that the placebo group was getting infection at a much higher rate than the one that were vaccinated. So they tabulated the results, and voila, 90% efficacy, which is unbelievable, unheard of in 2 doses of vaccine, by the way, just so that everybody understands. Unbelievable, because the only vaccine that we have had, and I never expected this thing, to be honest about it. I always thought that 50, 60%
Right.
we live with it. But 90%, only measles has done that. 2 shots of measles, 95% efficacy. But this one is also getting there. So now they've got a few more days. before the end of the 2-month cycle where they look at the safety study. And once they have looked at the safety study, if everything looks good, which seems like it is looking really good, then they should be applying for emergency authorization use with FDA probably this month or maybe in a week or two, which is going to be unbelievable. Thus, the vaccine potentially can be out. The manufacturer is now able to produce, will have this year 50 million vials globally, which means 25 million individuals can be vaccinated this year, and they're expected to get 1.3 billion vials next year, which means that over 6.5 million people can be vaccinated next year. So this is unbelievable news, excellent news, and we still have to look at it. On top of that, one of the things that everybody needs, from a safety perspective, once the vaccine is out, all the people, the 4,400 people, 44,000 people that were in the phase 3 study will be studied for the next 2 years to look at immunity. How long does the immunity last? And that is something really, really incredible that's going on. And this is not the only vaccine that's out there. It's
Right,
going to be out there.
right, but that is a critical question in regards to immunity. Let's talk, doctor, really quickly about distribution. Who's going to get this vaccine and who's going to get it first?
So for the distribution part is still not very clear. I think there are people working on it. Operation Warp Speed has a specific group that works on the logistics, and they're putting that piece together because it's not going to be easy to move this vaccine from point A to point B because of the temperature it has to be kept on.
Right.
But who is going to get the vaccine first? CDC determines the priority list, and then and they get input from the Committee for Vaccines, Immunization Policy Committee, ACIP, and then National Institutes of Medicine also chimes in. Okay, so all of them come together and they come up with who's going to be the top priority. Right now, what it looks like is that the healthcare workers in harm's way, let's call it harm's way, who are interacting with people who have COVID, will be the top priority in my mind. Then it'll come to people who have underlying conditions, and then obviously elderly will be number one, and then the elderly at large, nursing home populations and all that, and then the mission essential people that are people that need to be at work, then nursing homes, then school teachers and school students, and then the general population. So it will take time, but we will get there.
Yeah, it will take some time. But as you mentioned, though, this is not going to be the only vaccine. We've been talking a lot about this race towards a vaccine, but being first obviously is one thing, but we would like to have more than one vaccine, right? I mean, the race doesn't end just because one manufacturer is able to come up with something that is effective and safe.
Absolutely right. Multiple other vaccines that are going to come out. We've got another vaccine that's being built in a similar fashion as the Pfizer vaccine has been put together, and that's the Moderna vaccine, which attacks the S protein, and all that. So who knows? That vaccine, when the unblinded data is opened up, might also have efficacy or effectiveness as good as the Pfizer vaccine. Mm-hmm. And then there are so many other vaccines that are coming out, and people are working on it. So, I mean, this is just unbelievable. And we will have a vaccine. We should start vaccinating people this year based upon what I see right now, if nothing goes wrong. And then, for example, the general population should get the vaccine, start, in a massive way by April next year, or maybe March, who knows. But one of the things that is the most amazing part is that all the folks that were against the vaccine, right, who were saying, I'm not going to go get the vaccine, now 90% or plus effectiveness of a vaccine. I think a lot of people are going to be encouraged, and the folks in the public health domain always were worried about if people are going to get vaccinated. Now we know that they are going to get vaccinated because of how effective this vaccine is going to be.
Okay, doctor, really quickly, we don't have a whole lot of time left, but talk about this other therapeutic. Obviously, a vaccine is one aspect
Yeah.
to kind of curtailing the pandemic, but therapeutics also really important here.
Absolutely, we need to have therapeutics. We need to have all the tools in the toolbox. And one of the just I think last week, just a few days ago, FDA approved, gave emergency authorization use to a monoclonal antibody that has been put together by Eli Lilly, which can be used for mild to moderate COVID disease patients and adults as well as pediatric population. So that is another incredible stride in terms of fighting this disease.
Yeah, it really is sort of all hands on deck, trying to pursue all options available. Dr. Rashid Chotani, always a pleasure, Medical Director at IEM. Thank you so much.
Thank you so much.